Welcome to the Waiver Consulting Group. To establish a personal care services in Wisconsin, follow this professional roadmap to navigate the state's vocational requirements and the 2026 Medicaid enrollment mandates. Personal care services provide in-home assistance with daily activities to support dignity, independence, and safety for individuals with functional limitations through medically necessary, non-skilled support. The first step is business and state authorization. Register your business with the Wisconsin DeFi and secure your Type 2 NPI. You must apply for certification through the DQA Provider Portal, demonstrating financial solvency and passing a state survey. To operate, you must hire a Wisconsin-licensed RN to oversee all clinical assessments and staff supervision. The second step is staffing and compliance. All personnel must clear the Wisconsin Caregiver Law background check via the work system before starting work. Your personal care workers, PCWs, are required to complete at least 16 hours of training covering ADL support, medication reminders, and abuse prevention to meet DHS 105 compliance standards. The third and last step is technical and billing infrastructure. Implement the state-mandated SANdata EVV system to verify all visit times and locations digitally. Services require a physician's order and a personal care screening tool, PCS, for authorization. For 2026, ensure your billing reflects the updated ForwardHealth rate. If you need help with the process of setting up your agency, ensuring state compliance, or managing your Medicaid enrollment, Waiver Consulting Group provides full-service support to get you to your first referral in record time. Visit waivergroup.com or call 302-888-9172 to start your journey today.